So why don't we go ahead and get started? I'm Kevin Moss. I'm an editor here with the Guide to Health Plans for Federal Employees. I have two colleagues with me today that I just will introduce real quick. They're going to be monitoring the chat. They're going to be moderating the Q&A. So let me just quickly introduce Natasha and Abby. Do y'all want to just say hi real quick to everyone?
Yeah, sure. Hi, everyone. So, as Kevin mentioned, we will be trying our absolute best to get all your questions answered. We'll be in the comments answering them, and then at the end, there'll be a Q&A.
And yes, just to really quickly add, hi everybody, my name is Abby, and I'll be working alongside Natasha just to make sure we get to everyone's questions. We are here for you.
All right. Thanks, everyone. Apologize for not having my mic on at the beginning. And I was talking for a couple of minutes about something that I wanted to share with you, that this is the most consequential open season for annuitants, really, in probably the last decade or so. It's not every open season that you have a new plan type and a new plan option available to you, which is happening this year with Part D PDP plans or prescription drug plans. So I know there's a lot of questions. I've been monitoring all the questions that we get, plus paying attention to some of the forums with NARF. I'm actually giving a NARF presentation tomorrow afternoon on these Part D changes. We're going to get through all of that, but I first just want to thank you that you're here. I also want to thank you on behalf of our team that many of you have been supporting our Guide to Health Plans for many years, relying on it, and we wouldn't be able to continue to do what we do without your support. So let me just say thank you for that. So today, we have a short introduction from me, and then I will briefly talk about Consumers Checkbook and our Guide to Health Plans for Federal Employees. Then we'll do a high-level walkthrough of the 4 parts of Medicare, A, B, C, and D. And then we're going to do a deep dive on Part B, Part C, which is Medicare Advantage, and then all the changes that are happening with Medicare Part D. And then, if time allows, we'll also share some FEHB open season advice. Some housekeeping notes, just so everyone knows. At the end of this webinar, you will receive an email with the recording. So that will come to you automatically. It will take a little time for that video to process, but that email will come to you, so you don't have to ask for that. Second, either Abby or Natasha in the chat, they're going to pin these slides. So if you want these slides, there'll be a link that you go to where you can download the slides. Lastly, if you have questions, and I'm sure many of you do, if there's a Q&A function at the very top of Teams where you're able to put in a question, we're going to try to get through as many of them as we can at the end of this. And, you know, I hope that this actually doesn't last the full hour in terms of me talking in this presentation. So we have a lot of time to actually answer questions. If you're not comfortable sending your question through Teams here in this format, you can always email us at guidetohealthplans@checkbook.org. That's a direct email that goes to Natasha, goes to me. We answer hundreds, if not thousands of emails every open season, and we'll do our best to try to help you if we can't answer your question today. So just a quick background on Consumers Checkbook. That's our organization. I've worked at Consumers Checkbook for 25 years. Officially, I think 8 days from now is my 25th anniversary with Checkbook. I've worked on this Guide to Health Plans for federal employees for all 25 of those years. We're a nonprofit 501c3 organization that was founded in 1974. One of the ways we started was publishing Consumers Checkbook magazine, which is published in 7 regional markets around the country: Washington, D.C., Boston, Philadelphia, Chicago, Twin Cities, Seattle, and San Francisco. We have quality and price ratings on local businesses and healthcare professionals. So anything from home contractors, auto services, healthcare providers, doctors and dentists, pet care, and more. That magazine and website has quality reviews that we gather from our members and other local consumers. Then we do undercover price research as well that's conducted by our staff, where we're able to report both on quality and price. I think the thing that's most important to know is that we're independent, we're unbiased, we take no advertising from businesses, and any of our publications are on our website. No health plan is providing any advertising, and so I think you can trust that we always have the best interests of the consumer when we do our work and in our publications. And we're really dedicated to help consumers make smarter choices, especially when the choice is really difficult. And choosing a health insurance plan is really difficult. And I think I said when I was on mute that actually choosing health insurance is really, really complex, and it's really hard even for healthcare economists. And it does not get easier when you retire. It actually gets harder because you have more things in play in terms of your choices and how Medicare is going to impact that choice, and which FEHB plan does the best job of coordinating, or what about Medicare Advantage, or should I take Part B? There's even more choice once you retire and you're an annuitant. So we'll walk through those choices today. So if you've been around from the beginning, and maybe you have, this is our 45th edition of the Guide to Health Plans that we're publishing for the 2024 FEHB open season. So it started in 1979 as just a print guide. We still do provide the print guide, but we also have the plan comparison tool, which is a website which allows you to compare your options. And there's a lot of additional features on the website that we can't do in the print guide. Okay, so we're going to first just do a high-level walkthrough of Medicare. Many of you will know these things, but we'll just go ahead and go over them before we sort of unpack each part of Medicare. So we'll start in alphabetical order. Medicare Part A, this is the hospital insurance. When you apply for Medicare, you're going to be enrolled in Part A. Most folks don't pay an extra premium. During your working career, you are paying payroll taxes. And if you have enough working credits, then you're going to qualify for premium-free Part A when you turn 65 and are eligible for Medicare. Part A covers inpatient hospital, skilled nursing care, hospice, and home health care. All right, Medicare Part B. This is medical insurance. This is an option as to whether or not you're going to enroll in this, because there is a separate premium to enroll in Part B. Part B covers doctor visits, lab tests, diagnostics, durable medical equipment, ambulance, mental health, and other outpatient services. The premium for the standard Medicare Part premium, this is if your income is below $103,000 if you're an individual filer, or below $206,000 if you're a joint filer, is $174.70. This is an increase of almost $10 from last year. It's about almost a 6% increase. But the amount that you pay for Medicare Part B is driven by your income, and it's your adjusted gross income, and there's a 2-year look back on that. Every year, it's happened where the Social Security Administration updates these income thresholds. So these income thresholds went up from last year, I think, by $6,000. I think it was $97,000 last year for the first IRMA income tier. And that's, what these extra payments for Medicare Part B are called is IRMA, the Income Related Monthly Adjustment Amount. So if someone talks about IRMA, they're talking about the extra Part B premium that you may have to pay if your income is at these levels. And if you look at how the Part B scales with income, it actually scales pretty rapidly after the first tier. And this goes all the way up to almost $600 a month for Part B if you're at a very high income. Okay, Medicare Part C is also Medicare Advantage, or MA. Again, optional to join. Part C, or Medicare Advantage plans, There's an alternative to original Medicare. If you hear the words original Medicare, they're talking about Parts A and Parts B. But Medicare Advantage is a plan where you're still enrolled in Medicare, but they're going to package original Medicare Parts A and B, and oftentimes they're going to include Part D prescription drug coverage. Many times, Medicare Advantage plans are also going to offer additional benefits that original Medicare wouldn't provide. Things like vision care or dental care, maybe hearing aids, and wellness, things like silver sneakers for gym memberships. And the last part of Medicare is Medicare Part D. This is prescription drug coverage. Again, this is optional to join. You don't have to do it. Part D drug plans help pay for prescription drugs not covered by original Medicare. The premiums, and this is really a discussion for something that's non-FEHB. If you didn't have FEHB and you went out to try to get a Part D prescription drug plan, those typically do have premiums. And there's also IRMA for Part D. So the same income threshold applies to Part D. If you make more than 103,000 as an individual filer or more than 206,000 filing a joint tax return, you will be subject to IRMA. But notice how much less IRMA is. Even in the first tier, instead of almost $70, it's only $13. It's only scaling to $81 at the highest income level, not $600. So yes, there is extra IRMA for Part D coverage. It's far less than from Part B. So one of the number one questions that we always get is, should I take Medicare Part B since it is optional? People have their employer-sponsored health insurance in retirement. If you are enrolled in an FEHB plan for up to 5 years before you retire, you earn eligibility to keep your FEHB coverage in retirement. And folks ask, should we take Part B? And the answer really depends upon your situation. There are a handful of cases where taking Part B may not make financial sense for you if you fall into one of those high income categories, more than 103,000 individual or 206,000 for joint filers. Part B is going to be of less financial value because you're having to pay that higher Part B premium. This is especially true if you find yourself not just in the first tier of IRMA, but maybe find yourself in the second or third or even a higher tier of IRMA. In that situation, taking Part B is probably never going to pay off for you financially. You're probably never going to get the value of making that decision out in terms of reduced healthcare expenses versus that much higher premium that you're paying. But if you fall just into the first tier of IRMA, and this is important, you're willing to consider optimizing your choice of plan, whether that be an FEHB plan that does a really good job of coordinating benefits with Medicare, or even considering enrolling in a Medicare Advantage plan, then taking Part B will make sense for you and still will probably be the least expensive plan choice for you if you're making a good plan choice along with having Medicare Part B. And what's true is that some plans have better Medicare coordination benefits than others. And if you're with a plan that doesn't coordinate well with Medicare and you're not willing to switch to a plan that does a better job, you might be better off not taking Part B, because if Part B is not going to reduce any of your out-of-pocket costs and you're still going to have to go to the doctor and have either a co-insurance or a copay, then you're not really getting any benefit of having Part B, although it's always there if you need it. So I wanted to show you a couple of examples of what we mean by plans that do a good job of coordinating benefits versus plans that don't. In the official plan brochure, which you can get the official plan brochure on our website, either if you're comparing plans in a side-by-side mode, or you're clicking on a plan name, we call that the plan detail mode. The plan brochure will be a link that's displayed on that page. If you go to section 9, this is the section where the FEHB plan will talk about how they coordinate it with other health insurance and, importantly, Medicare. In there, they will tell you what happens when you decide to take Medicare, and when Medicare Part B becomes primary, what happens to your FEHB health plan benefits. So the first example is actually from Blue Cross Basic and Standard. And they tell you in the plan brochure, when you have Medicare Part B primary and you have standard option, the deductible is waived. The coinsurance for inpatient and outpatient services from physicians is waived, and the coinsurance for outpatient facilities is waived. If you have basic, now basic doesn't have a deductible, but they're also going to waive copayments and coinsurance for care received by professional and facility providers. So these are examples of plans that are going to reduce your costs when you have Part B. You're not going to have out-of-pocket costs now when you go to the doctor. And this is an example of plans that do a good job of coordinating with Medicare. Below is an example of a plan that doesn't do well. Health Alliance HMO, they're available in the Midwest. You will find other plans that will say the same thing when you look in section 9. And they'll just say very bluntly, we do not waive any costs if the original Medicare plan is your primary payer. So you will still face those out-of-pocket costs when you go to the doctor if you're in Health Alliance HMO. So if you find yourself in a plan where you're not going to waive, no costs are going to be waived when having Medicare, you might look to find some plans that do a better job of coordinating with Medicare. All right, well, let's talk about reasons that you would want to enroll in Part B. Now, most federal retirees will actually enroll in Part B. Almost like 70 to 75% of all federal retirees will enroll in Part B. And you want to maximize, this decision of taking additional insurance coverage. So make sure you find a plan that has wraparound benefits that are going to reduce your costs for medical services. It's going to help offset the expense of you paying a second premium. There are some plans that are going to reimburse or reduce some of the Part B premium, including 2 national plans, Blue Cross Basic and GHA High. So Blue Cross Basic, I believe it's $800 a year per person that they're going to reimburse on the Part B premium. And if you're in a plan that has, that has an HRA, so one popular example that many retirees have, Aetna Direct, CDHP, you can use that HRA contribution to help pay for Part B premiums. Or if you had a high deductible health plan leading up to retirement and getting on Medicare, you no longer get any new plan contributions into the HSA. You can no longer make voluntary contributions into an HSA once you're on Medicare, but you can use the funds in the HSA, that's a qualified medical distribution. It will cost you nothing to pay for your Part B premiums through the HSA. The other thing that you have access to when you have Part B, you're going to have more access to providers because you could just go and use your Part B benefit to go out of network of your existing plan. So how this works is, let's say, for example, you have Blue Cross Basic. One of the big differences between Blue Cross Basic and Blue Cross Standard is Blue Cross Standard has out-of-network provider coverage. Blue Cross Basic, you are limited to the Blue Cross provider network. But with Part B, and if you decided to take Part B, you could go to an out-of-network provider with that accepted Medicare, with your Part B benefit, and use Medicare Part B to go see that provider. Now, if you did so, you would still have out-of-pocket costs in that scenario. You'd be subject to the Part B deductible, which I think it's somewhere around, it went up a little bit from last year, but it's somewhere around $240 or so. And you'll still have to pay 20% for the cost of service when you go see that doctor outside of your health plan. But it does give you more options and really does expand the provider network of many plans when you have Medicare Part B. All right, let me take a small drink of water here. Medicare Part C, Medicare Advantage. This has been one of the big developments that have happened over the last 3 or 4 years, where we've seen FEHB plans start offering Medicare Advantage plans as kind of almost a package with their FEHB plan. Medicare Advantage is also called Medicare Part C, managed by private insurers approved by Medicare. So again, these plans bundle original Medicare, and they often offer extra coverage for items like vision, hearing, dental, and wellness. And a Part D prescription drug plan is also really kind of baked into these plans. These plans have been available in the FEHB program for the last few years, and there are even more options available to you to consider this open season. And this is a plan that if you haven't looked at it yet, you definitely want to spend some time to consider these plans to see if they might be a better choice for you. And importantly, for most annuitants, this will be the least costly plan option for them next year, is enrolling in one of these Medicare Advantage plans, and we'll walk through why that is true. So next year, there's 40 MA plans that are available to choose from. There are national plans and there are local plans. New for next year, GEHA High and Standard have Medicare Advantage plans for the first time, but you'll find these plans with NALC High, MHBP Standard, APWU High, Rural Carrier, Foreign Service, both Samba plans, Compass Rose, and Aetna Advantage. Those are the national plans that are available. There are also local plans offered by United if you live in one of the markets that United serves, which is about half the country. Also, if you live in one of the Kaiser markets, Atlanta, DC, Denver, Colorado, Northern and Southern California, the Pacific Northwest, and Hawaii. Also MBIPA in the DC area, CDPHP, Health Alliance, Health Net of California, and UPM Standard in Western Pennsylvania. All right, so one of the ways that these plans are going to reduce costs is most of the ones that we model, and this isn't true of all the FEHB Medicare Advantage plans, but for the ones that we model, the ones that you're going to find in our plan comparison tool, they all have a generous Part B premium reimbursement. Some is more generous than others. For example, United Healthcare is $150 a month, and that's covering almost the entire Part B premium, less, like $25 or so. And Kaiser, in some of their California markets, they will actually reimburse even above the standard Part B premium. So if you were subject to a late enrollment penalty for Part B because you were late to enroll, or you are facing IRMA and have to pay a higher Part B premium, they'll go all the way up to $250 a month on reimbursement. So this is the first way that these plans are going to save money, because instead of you having to pay two premiums now, that full FEHB premium, that full Part B premium, these plans are eliminating, in some cases, half or even more than half of that Part B premium. Next, and this is also not true of all the Medicare Advantage plans, but for many of them, especially Aetna, GHA High, United Healthcare, you are paying zero out of pocket for approved healthcare services from providers that accept Medicare. The only out-of-pocket costs you will face is prescription drug costs. So it's $0 to go to the doctor. It's $0 for hospital. It's $0 for acupuncture, $0 for chiropractic. It's $0 for every medical benefit in some of these plans, except for prescription drugs. And in the case of Aetna Advantage, they have brought a $2,000 catastrophic out-of-pocket maximum on prescription drugs 1 year earlier than required by the law. And so in Aetna Advantage for 2024, you'll never pay more than $2,000 out of pocket for prescription drug coverage. So this combination of the Part B premium reimbursement plus zero out-of-pocket costs from providers that accept Medicare, it's really the only costs that are left then are whatever you will face in terms of prescription drug costs, the FEHB premium, and then whatever's left of that Part B premium. Now, many of the FEHB Medicare Advantage plans, they also have special benefits like silver sneakers, Some of them have hearing aid coverage, even some have dental coverage. Many of them now also have a quarterly over-the-counter allowance where they're going to give you some portion of money for reimbursement for over-the-counter items like allergy medications or pain relief medications that you would purchase over the counter. I think the United plans, it's $40 a quarter. So that's, $160 a year. And if there's 2 people on that plan, that's $320 of over-the-counter pharmacy items that this plan is going to cover for you. So when we look then at the combination of this Part B reimbursement plus no out-of-pocket healthcare costs besides prescription drugs, we see much, much lower costs in these plans than some of the popular plans that we know a lot of retirees have. In this chart here, we're showing the estimated yearly costs for a couple who lives in the Washington, D.C. area, enrolled as Self+1, where the primary insured is age 70 and they expect average healthcare expenses. When we model all the plans, we show over $8,000 of savings switching from Blue Cross Standard to United Choice Primary Retiree Advantage. Now, that option won't be available to everyone because United is not a national plan, but you could still save almost $8,000 switching to Aetna Advantage Medicare Advantage, which is a national plan. Tremendous amount of savings. Most of these savings are going to be a for sure savings because the Blue Cross Standard's average yearly cost, a large majority of that cost is based on for sure expense of Blue Cross Standard having the highest premium of any national PPO plan, and Blue Cross Standard does not have any Part B premium reduction. So you're going to be paying the full Part B premium in that. So most of these savings are absolutely for sure savings from switching from something to like Blue Cross Standard to United Choice. These savings are so significant that you have to study this to see if these plans are going to be the right plan for you. I can hardly think of another way where you might be able to save this amount of money by just making one decision next year. And this is one of them, Medicare Advantage plans. All right. With Medicare Advantage, one of the rules is that you have to have both parts of Medicare in order to enroll. So you must have Medicare Parts A and you have to have Medicare Part B as well. So both parts of original Medicare. To sign up, now this is a little bit different than what you experience now of just enrolling in an FEHB plan, because there's an additional step that you have to take. So to sign up, you first must enroll in OPM in the corresponding FEHB plan that's sponsoring the MA plan. So if it's one of those United Choice plans, you would go to OPM, you would enroll in United Choice. And then the data does not flow instantaneously from OPM to the health insurance carriers. Sometimes there's overnight processes involved. And so if you decided to enroll with OPM, let's say noon on a business day, and then at 2 o'clock called the MA plan and said, hey, yeah, I want to enroll in your MA plan, you're not going to be on the member roster yet because the data doesn't travel that fast from OPM to the insurance carrier. So what I say is wait a business day or two. So if you do it on a Wednesday, maybe wait till Friday to call the MA plan, because that's the final step. So the first step is you enroll with OPM in the corresponding FEHB plan. Then the final step is you have to contact the Medicare Advantage plan. Most of the time that has to happen over the phone, but some of the plans also have this availability to enroll on the plan website in the Medicare Advantage plan. But they all have special MA enrollment phone numbers. So to find out more about these Medicare Advantage plans, you want to go to Section 9 of the official FEHB plan brochure. They will display or show their Medicare Advantage hotline for you to call to enroll, or you can also get more information from the plan website. Most of the Medicare Advantage plan websites have really good information. You'll be able to get a summary of benefits that's not quite as robust as an FEHB plan brochure, but definitely will tell you for every medical service how much that will cost in the plan. And for many of those plans, you'll find that it's zero cost. And then there's also sometimes evidence of coverage, which is a much lengthier document that goes up to like 120 pages. Many of the Medicare Advantage plans will have that on their site as well. So if you're looking for more information, you go to the plan website to find that. So what are some reasons maybe why Medicare Advantage wouldn't be the right choice for you? And this is not going to be the right choice for everyone. So let me just say that. Well, I think it's going to be the best financial choice for many people in an important way to save money. It's not going to be true for everyone. So first is, well, if you're subject to IRMAA, then paying that higher Part B premium is going to erode some of the financial value of being in one of the Medicare Advantage plans. But if you're just in the first tier of IRMAA, the Part B reimbursement and zero cost share, besides prescription drugs, are still probably going to likely result in Medicare Advantage plans as the least costly plan choice, especially if we consider that if you already have Medicare Part B and you're already paying IRMAA, no other plan in FEHB will have lower costs than one of these plans because there's no Part B plan that has Part B reimbursement as generous as you'll find in these Medicare Advantage plans. So even if you're paying IRMAA, I think that you should still take a look at the Medicare Advantage plans. If you spend considerable time overseas, most of the FEHB Medicare Advantage plans are not going to cover routine care overseas. There is an exception to that. United Healthcare does have some routine overseas coverage, but if you're spending 3 months, 6 months, or maybe longer overseas, this plan type outside of United Healthcare will not work for you. You'll not be able to get routine care overseas, so keep that in mind. The final example is provider network. Now, the FEHB Medicare Advantage plans state that you can see any provider that accepts Medicare, but the provider must also accept the Medicare Advantage plan, and that's the rub potentially. So you definitely have to check your providers. In the online provider directory that the Medicare Advantage plans have, make sure that you check to see your current providers, that they will still be covered in this Medicare Advantage plan, and any future providers that you might want to see if they'll be covered. You know, if going to popular or famous networks or provider networks that are out there, you know, things like Cleveland Clinic or Mayo Clinic or MD Anderson, if you think that at some point having access to those providers will be something that you need, you should go and check to make sure that your providers are going to be covered in the Medicare Advantage plan. I strongly suggest doing this before deciding to enroll in a Medicare Advantage plan. All right, we're moving on to Medicare Part D. Now, most federal employees have not had to worry about Medicare Part D in the past because FEHB prescription drug coverage has been as good or better even than what you could get from a Medicare Part D plan. And why pay an extra premium for something that I'm already getting paying my FEHB premium? But in 2022, there was an important piece of legislation that was passed that contained major Part D reform. So it was the Inflation Reduction Act. And there are important reforms that are already out there in the marketplace this year and more to come. So what's different in Part D? Well, this year, insulin prices are capped at no more than $35 a month. Next year, there still is this kind of donut hole thing with Part D, and there's this catastrophic coverage stage where if the spending between the enrollee plan and drug manufacturer reaches $8,000, there's still a portion of costs that the enrollee must pay. That's being eliminated in next year. So there's no longer any catastrophic coverage enrollee share. And then starting next year, Part D premiums are going to be limited in terms of their premium increases. So Part D premium can increase more than 6% in a given year. This lasts all the way through 2033. And that protection is important. Last year, Part D premiums increased about 10% on average. So 6% is important protection there. And the big change, and it's not coming next year, but it's coming the year after, in 2025, there's an out-of-pocket spending cap where no enrollee in a Part D plan will have to pay more than $2,000 out of pocket on prescription drugs. And there will be some mechanism built in these plans so that you will be able to spread out that $2,000 over the course of the year, which means that no Part D enrollee will ever have to pay more than $167 or so per month for prescription drugs. The OPM in the spring saw that this reform had passed and wants federal annuitants to receive this improved Part D coverage. And they opened the door by notifying the carriers in the spring that they could start offering Part D coverage in two ways. One way we already talked about, and that's the Medicare Advantage Plans, that package Part D. That's one way to get Part D coverage. But the other way is through a prescription drug plan or a PDP. The other thing that you might have heard these plans called are EGWPs. It's an acronym EGWP, that stands for Employer Group Waiver Plan. OPM signaled to carriers that they could start offering PDP plans for plan year 2024, and their guidance was the benefits from the PDP plan must be as good or better than the benefits, the prescription drug benefits from the FEHB plan. And if the plan was able to pass that test from OPM, then OPM would also allow those plans to auto-enroll plan members who had Medicare into the PDP plan for improved Part D coverage. And so this notice was a little bit late in the cycle from CMS, who manages Medicare. And so not all plans jumped on this. I do expect that over the next couple of years, most, if not all, FEHB plans will have a Part D prescription drug plan along with them. But for next year, there are 17 FEHB plans that will offer prescription drug benefits to annuitants that have Medicare through a PDP. And this is the first time this has ever been offered. And so again, it's not every year that you get a new plan type, but you do have a new plan type available to you for the upcoming plan year. So these are the 17 plans. And if this impacts you, you should already know. And how you know is that you should have already received a letter from your insurance plan letting you know that you're going to be getting prescription drug coverage through one of these PDP plans. So here are the plans: all Blue Cross plans, standard basic FEP Blue Focus, NALC High, all MHBP plans, APWU High, Rural Carrier, Foreign Service, both SAMBA plans, both Health Partner plans, and Aetna Direct Consumer Option, and Aetna Open Access just in the DC metro area, high and basic. And I do want to flag certain plans: Blue Cross Standard, all MHBP plans, all Aetna plans, Rural Carrier, and Foreign Service. They all have built in a $2,000 annual prescription drug out-of-pocket max this year, 1 year early than what's required by law. For 2025, all of these plans will have the $2,000 prescription drug out of max, but these handful of plans will have it for next year. So again, for OPM approval to get a PDP through, they must provide as good or better prescription drug benefits than the FEHB plan, and with no extra premium. Now, that no extra premium part applies just to annuitants that pay the regular standard Medicare Part B premium. So income, again, below $103,000 or $206,000, there is no extra premium when you get this PDP plan. When we've reviewed these benefits, this appears to be true, that the benefits are as good or better, especially true where a plan is now offering a prescription drug catastrophic max where they previously had none, and you'd be subject to the out-of-pocket max for the plan for all medical care. Here's one example from Aetna Direct, which I think they did a good job in their plan brochure of sort of telling you what's life like in the FEHB plan, what's life like in the PDP plan. So the one thing that is a little bit unclear is when there's a coinsurance value, how does that compare to a fixed copay, right? So if we look here at preferred brand, if we just have the FEHB plan, we would pay 30% up to $600. And with the PDP plan, we'll pay a fixed copay of $45. Well, the question that you're always going to have is 30% of what? Because if it's 30% of $100, then $30 is less than $45. But if it's 30% of $200, then $45 is less than $60. And so you will have to do a little bit of homework for prescription drugs that you take. You will want to go to the plan website. Most of the plan websites that offer the PDP plan have prescription drug cost tools where you'll be able to put in your prescription, put in the dosage, and oftentimes also select the pharmacy that you want to go to, and they will display a price. I would highly suggest that if you are going to be auto-enrolled in a PDP plan, that you confirm that you're going to get lower pricing from the PDP plan versus what the FEHB plan will provide. So you will be auto-enrolled if you have either Medicare Part A or Medicare Parts A and B, and you're in one of those 17 FEHB plans. And that's true for all plans except for Blue Cross. If you have a Blue Cross plan and you just have Medicare Part A, you will not be auto-enrolled. You're only auto-enrolled if you have both parts of Medicare, A and B. You should have already received a notification from your plan if you've been auto-enrolled. You're going to have 30 days to opt out of that PDP. After the 30 days, you'll receive a new prescription drug card. That's the card that you're going to use now when you go to the pharmacy. You no longer use your FEHB health plan member card. You're going to use your prescription drug insurance card. Coverage is going to begin at the 1st of 2024. If you aren't in one of those 17 FEHB plans that offer a PDP, or maybe you are in a Blue Cross plan and just have Part A, you can, if you want to, you can enroll in one of these plans. You're going to have to, this enrollment's going to be done by the plan. It's not done by OPM to get into a PDP plan. You're going to have to go to the plan website to find the enrollment instructions. Oftentimes, it's probably going to be calling a phone number, a hotline, in order to either sign up or to tell the plan that you don't want this. You'll have to call, and I've been monitoring some of the user forums at that NARF sponsors, and I've already heard some of the horror stories of people that have experienced long hold times, 30 to 40 minutes. I hope that those improve for you, but I also will give you, a suggestion that if this is something that you're interested in enrolling in, or if it's something that you're interested in getting out of, I would do it sooner rather than later, because there may be a little bit of friction involved for you to do what you're after. All right, so let's talk about, some ways to think about this, and maybe some reasons why you might not want to enroll or stay enrolled in one of these PDP plans. So again, if you're a high-income annuitant defined by SSA as over 103,000 single, or 206 or more for a joint filer, you will be subject to IRMA. But keep in mind that IRMA is much lower in Part D. So it's only about $13 a month per person for Part D IRMA, which is far less than Part B, where first tier is almost $70. And I think many people may find that the value of this improved prescription drug benefits going to be worth more than Part D IRMA. If you do decide to opt out, you can opt out, you can opt back in to Part D coverage at any point in the future without an enrollment penalty. That's because your FEHB prescription drug coverage is considered credible coverage from OPM. So you're never going to face any late enrollment penalty if you decide, hey, this isn't for me, I want to get out of it. You can decide to do that. You can come back at any point, get back in, you'll not have to pay any late enrollment penalty. If there are some plans that have a Medicare Advantage plan and they now have a PDP plan. But if you were in one of those Medicare Advantage plans, they're not going to auto enroll you in a PDP plan. So if you have NALC High or MHBP Standard, APW High, Rural Carrier Foreign Service, or Samba High and Standard, and you're in their Medicare Advantage plan, they're not going to take you out of that and put you in a PDP plan. They're going to keep you in that Medicare Advantage plan. One other thing, and I don't know how often this happens, but it at least happens more than once, where annuitants have decided on their own to keep their FEHB plan, but also enroll in a private Medicare Advantage or private Part D plan outside of FEHB. If that's you and you did it, and you're in one of those FEHB plans, one of those 17 FEHB plans, you will going to be auto-enrolled in that PDP EGWP, and it will disenroll you from that private Medicare Advantage or PDP plan. So I think not many people do decide to do that, but if that's something that you have done, you'll have to understand what's happening there and then make a call as to whether that PDP EGWP is better than your private Part D plan. It might be, because there's no extra premium if you're under the income threshold, but you'll have to weigh those choices to see which one is best for you. All right. You got to check to make sure your prescription drug is going to remain covered. I've talked to some of the health plans. They have done, they say they have done a very good job to make sure that any prescription drug that was covered by the FEHB plan is still going to be covered by the PDP. But understand that the drug formulary is for the PDP is not managed by OPM anymore. It's managed by CMS. And there could be differences in how the drugs are classified between the PDP plan and the FEHB plan. In terms of the tiers that a prescription drug is assigned, there could be a difference in what tier your drug falls under the FEHB plan versus what tier your drug falls into the PDP plan. And that could impact cost. So you definitely, as we've said earlier, you got to check your prescription drugs. I also have some, comments for you that this is also not easy. I was on the Blue Cross website, and they have a prescription lookup tool where you can put in your prescription drug, you can put in your dosage, and you pick your pharmacy, and then you pick which plans you want to compare. And they allow you to say, okay, I want to see Blue Cross Basic plus Blue Cross Basic with the PDP. You hit submit, and the whole thing crashes, and it says, this isn't your fault, it's our fault. Come back later. That's been going on for 2 weeks now. I don't know if that's getting fixed, but that is really, really important to be able to do that. And so there's some friction right now in being able to easily do that. I hope that gets fixed. I don't know if it's going to get fixed. You may have better luck over the phone with one of their representatives, asking them, hey, these are the two drugs I take. What's my cost in the FEHB plan? What's going to be my cost in the PDP plan? To find out more information on these PDP plans, there's 2 places that you might have to look. Section 9, again, of the official FEHB plan brochure will have some discussion of this, but there may be more extensive discussion in Section 5F. That's the prescription drug section of the FEHB plan. Some of the carriers decided to put more information in Section 5F. But they will tell you where you can go to go to the formulary lookup or to find a pharmacy pricing tool. All right, there's 2 more reasons maybe for you to not want to take the PDP plan. One is if you receive prescription drug assistance from a pharmaceutical company, so this would be like a discount coupon to purchase a prescription drug, you will lose that assistance if you're enrolled in a Part D plan. You no longer qualify to get one of those discount coupons that a pharmaceutical company might offer. My advice, if that's you and you do get some of that assistance or take advantage of those discount coupons, check to see how that prescription drug is going to be covered by the PDP, and then decide if the pharmaceutical assistance is worth more than the PDP coverage. But also keep in mind that the PDP coverage is not just, for that one prescription drug. It could be much broader coverage than just that, and it is much broader coverage, especially there's protections in some of those plans to not have to pay more than $2,000 out of pocket for prescription drug costs. Here's an interesting tidbit. PDPs, as defined by CMS, have no coverage for drugs obtained or purchased overseas. So if you, let's say you were on holiday and you were, rented a villa in Tuscany for a couple of months and you broke your leg and you had to go to the hospital, the FEHB plans have emergency overseas care, but when you're getting your prescription drug coverage from the PDPs, then you won't be able to get coverage for drugs. So you may not get coverage for painkillers that you might be prescribed to help you with your broken leg. But so that's true, but most travel insurance policies are going to cover healthcare expenses not covered by health insurance. So if you do expect some international travel and you do have this PDP plan, understand that whatever portion of the medical bills related to prescription drugs, your PDP plan won't cover, but most travel insurance policies will cover healthcare expenses not covered by your health insurance. So that's a way to sort of help with that problem. All right. So we've only got a couple of minutes left because I really want to get to questions, and I haven't even checked in, and I'm sure there's a lot. So let me just briefly give you a couple FEHB open season things, and then we'll get into questions. So if you haven't heard, premiums are going up. Not quite as bad as last year, but still pretty high. And if we put both of these years together, we see one of the highest 2-year periods of increases over the last few years, really. We only have to go back 2 years to see FEHB premiums only increasing 3.8%. Understand that the price increase isn't uniform. Premiums actually decreased in 31 plans, stayed the same in 8, increased below the 7.7% 68 times and above it for 47 times. But overall, the trend is higher premiums for FEHB plans. Blue Cross plans, since we know many people have Blue Cross Standard went up 6.5%, Basic 10.3%, and FEP Blue Focus 2%. In terms of new and discontinued plans, not a lot of new to talk about. In the DC area, Centara Health now has a new plan in Northern Virginia. And if you qualify to enroll in Compass Rose, they now have both a high and standard plan. And they also added the Department VA as a qualified agency. So if you retire from the Department of VA, you now have access to Compass Rose where you previously didn't. There were a lot of plans that left FEHB, but almost all of that was Humana plans leaving. So we went from 271 to 156 next year. Almost all of that is Humana, but a few other regional HMOs also left. Indiana University and Bloomington and AltCare in Ohio, and one national plan, NALC Value, no longer available next year. One piece of advice for everyone, even if you're not motivated by switching plans and you're not motivated by looking at a Medicare Advantage plan, you should be motivated to understand how your plan is changing next year, and go to the official plan brochure. Go to section 2. This is how this plan is changing for next year. Find out if there's any important benefits that you use that are going to be different next year. Also, don't assume that your existing doctors and prescription drugs will still be either preferred or still on the formulary. APWU plans actually are switching provider networks from Cigna to United next year. That could impact whether doctors are still in network if you have an APWU plan. So we always advise, check your provider directory, see if your providers are still going to be preferred. You'll always pay less when you go to preferred providers. And then on the prescription drugs, see if your prescription drugs are still going to be covered. And you can go, most of the websites have formulary lookup where you can see any changes to that. All right. That was a lot, and there's a lot going on. And so I kind of had to power through a lot of that. We've written more extensive advice on this, both on our website. You might find our articles out on Government Executive and on FedSmith, other news outlets, but I am here to answer questions, and I'm going to turn it over to Natasha and Abby. for them to start asking me questions. And I will just say up front, if sometimes I get really, really smart, insightful questions from this audience, which I love, but I may not be able to answer it right away, just off the cuff. And so I may ask you to send me an email to guide-to-health-plans@checkbook.org, and we'll take care of it after this webinar is concluded. All right.
Okay, so time for questions. So we got a lot of questions, so I don't know if we'll be able to get to all of them, but we're going to try our best to answer some of the general questions that people had. So let's see, we have some Medicare Advantage questions. So someone wanted to know which health plan / Medicare Advantage plan offers the highest Part B premium reimbursement?
Okay, so that is going to come from Kaiser. It's not available in every Kaiser market, but I know the one example I gave on my slide was the Northern California. So it's up to $250 a month, but you're not going to get the full 250 unless one of two things. You are subject to a Part B late enrollment penalty, or you're subject to IRMA. So the answer is Kaiser, but I want to caution that that's just one aspect of cost. And it's an important one because it's going to help reduce, in the case of Kaiser, it's basically netting the Part B to zero. But it still isn't taking into consideration two other things. What is the FEHB premium, and what are my out-of-pocket costs? Kaiser is one of those plans where they don't zero out everything on healthcare services, and there's still going to be some leftover expenses. When we model the plans, the Kaiser plans do pretty well, but we tend to see that the United plans and the Aetna plans do a little bit better in terms of the yearly cost modeling, because their FEHB premium is probably a little bit less, and they're covering more out-of-pocket healthcare costs at $0.
Okay, awesome. All right, next Medicare Advantage question is, do most doctors take Medicare Advantage, or do more take original A and B?
The caveat with that is that on Medicare Advantage, they must take the Medicare Advantage plan. So in theory, in a perfect world, the answer would be the same. But we don't live in a perfect world, because the way that the plans state this is that you can see any doctor that accepts Medicare, but they also must accept the plan. We've heard some feedback from our users over the years that, I forgot the specific situation, but it was with Mayo Clinic, and Mayo Clinic wasn't going to take one of these Medicare Advantage plans. So in theory, the answer is that they should be the same, but in practice, they probably aren't. And that's why I highly suggest that for providers that matter to you, before enrolling in a Medicare Advantage plan, you must go check to see if those providers are going to be in network and covered.
Okay, all right. So next question is, I read a lot that MA plans have more stringent pre-authorization and denial requirements than regular health plans or original Medicare. Is this true for MA plans?
This is one of the elements where there's a little bit of cloudiness on. And the reason being is that these Medicare Advantage plans are not managed by OPM. They're managed by CMS. And the quality assessment of them is managed by CMS. It's not managed by OPM. For FEHB plans, there are quality measures that OPM publishes. You'll find those quality measures on our website, and some of the measures that you'll see is, their claims denial and some other measures of quality that OPM reports on. CMS also judges the quality of plans through a star score ranking, but it's quite hard to actually find out which Medicare Advantage plan, that this FEHB plan, how does that correspond in the data? Because you actually have to have the plan contract number, which regular folks cannot get because it's not typically displayed on plan documentation. And so I have looked at the star scores for some of the Medicare Advantage plans that have been around a while, such as United and Aetna. I can't tell you off my top of my head what their overall quality ranking is, but they're either 4 or 5 star plans from both from Aetna and United. I have heard that same thing about Medicare Advantage, but I haven't seen it in practice. We get a lot of feedback from our users, and of course, CMS is sending out surveys to all their plan members, at least a sample of the plan members, to get reporting on that. So I think if that is actually an issue, it is going to start showing up in those star scores, and that is one thing that's on our list to help provide a little bit more sunlight on, are what those quality rankings are, because I think it will give people comfort that these Medicare Advantage plans are as good as FEHB plans in terms of covering services.
Okay, and going off of that question, something kind of similar is, um, are there any information regarding difficulties that have been encountered with Medicare Advantage plans to be mindful of?
Um, well, certainly access to providers. I would highlight that one very strongly. Outside of that, the CMS, again, the CMS star scores, they're out there, but it's impossible to navigate. They're huge data sets with really complex Excel and columns and rows. And we have a lot of experience dealing with data like that, but they're not really published in a user-friendly way. And oftentimes the names the names don't carry through. So Aetna Advantage, Medicare Advantage is not what CMS knows that plan to be, for example. So I will say it's an item on our list to bring more transparency on the quality scores of the Medicare Advantage plans.
Okay, and last Medicare Advantage question is, can you go out of network with the FEHB Medicare Advantage plans?
Yeah, so in theory, you can go to any provider that accepts Medicare and accepts the plan. And in theory, that means a broader selection of providers than what the FEHB plan will provide, with the caveat that you need to go and for any provider that you're interested in to confirm that they're going to be covered in the Medicare Advantage plan.
Okay, great. So next we have some Part B questions. So someone wanted to know if I have refused Part B, can I enroll in Part C without penalty?
Well, probably not, because every year that you don't have Part B and could have Part B, you have to pay a 10% late enrollment penalty, and the penalty stacks. So an easy way to think of it is, if you turn 65 and that was your initial enrollment window, and you're now 75 and you missed 10 years, you will pay 100% penalty, which is double the standard Part B penalty. So if you don't have Part B and you've missed it, it may be something where even if you've only missed it for like 2 or 3 years, I haven't exactly done the math in terms of when it would still pay off for you versus when you cross the threshold for it not paying off for you. But think of yourself, if you wouldn't necessarily qualify for IRMA, that you're kind of an IRMA person now because you're going to be paying a higher Part B premium. If you've only missed 1 year, it's 10%. And so that's what, an extra 20, less than $20 a month. So it still may be the best financial choice for you. But if it's been, 7, 8, 10 years, at that point, I think the ship has sailed and that this option isn't going to be a good option. I think you'll not get the value out of it versus the higher Part B premium that you're putting in.
Okay, and next question is, what are the best FEHB plans to have if I decide to drop Part B due to a monthly Part B premium increasing for myself and my spouse?
You're looking for at that point. So what happens when you have Part B? What's supposed to happen is that, there's wraparound benefits. And the idea is that if I'm paying this extra premium, that's going to reduce my out-of-pocket costs. If in this particular case, this person's subject to IRMA and they're not really feeling like Part B is working for them and they want to drop that and save some money, then you're back to basically as you were as an employee, but you're then thinking about, well, what's the overall premium I'm paying and what are my out-of-pocket costs? And this is something that you can find how the plans rank on our plan comparison tool. You can just do that scenario where you say that you put your family in and say that you have Medicare Part A only and see how the plans are ranking on yearly cost estimate. That's going to show you which plans will offer the most value for you in that situation. It will also tell you what you'll now have to pay out of pocket when you're in one of those plans.
Okay, awesome, awesome. And last Part B question is, it's kind of a specific question, but I think it might apply to a lot of people. So I have a self plus one. My wife has Medicare Part B, but I do not. When I use the guide, should I specify that we have Part B or that we do not have Part B?
Yeah, so there is one. This is a scenario that we didn't talk about, but it is something that's true, and that is not everyone, if they're a couple, turns 65 the same year. So one spouse is going to be ahead and Medicare qualified, and one isn't. When you use our tool, you can say one person has Medicare AB, one person does not. But there is something you should know that's an option, and I didn't talk about it, so I'm sorry about that. But you can actually join a Medicare Advantage plan. So the spouse who has Medicare Parts A and B, if you enroll in an FEHB plan that sponsors a Medicare Advantage plan, the spouse who's Medicare qualified would get the Medicare Advantage plan. The spouse without Medicare would get the FEHB plan and the FEHB plan benefits. And the benefits calculation is quite clear on the Medicare Advantage side that those benefits and costs are much less than an FEHB plan. But what you really have to pay careful attention to in that scenario is what does the non-Medicare person's benefits look like? In some cases, there might be, like Aetna Advantage, for example, has a high deductible, might have a smaller network because you aren't able to go to all Medicare providers. You have to go to Aetna Advantage providers. So before thinking about that, you have to carefully consider what those FEHB plan benefits are that the spouse who doesn't have Medicare would receive.
Okay, awesome. So now we're going to move on to some Part D questions. So that's an exciting new option that they have. So let's see. The first one we have, if one opts out of FEHB Part D option this open season, is it possible to opt in at a later open season?
Yeah, absolutely. In fact, I spoke with one of the plans yesterday. You can actually go in and out of that PDP plan. So there was a scenario. I'm not necessarily advocating that this is a real thing anyone should do because there's administration involved and there's a lead time and you can't just snap your fingers and have this happen. But I was discussing this overseas coverage of prescription drug costs and that these Part D plans don't cover overseas prescription drugs. And this representative from the plan told me that you could enroll in the Part D plan and let's say in April, drop the Part D plan and move back to FEHB prescription drug coverage because you were planning in June to go to Tuscany for 2 months. So then you're in Tuscany from June to July. And then when you get back, you tell the plan, hey, I want to get back in the PDP plan. And, that may take up to like 30 days, to get back and to move back and forth. But you can get back in. You don't have to wait till open season. And importantly, because FEHB prescription drug coverage is considered credible coverage by OPM, you'll never have to pay a late enrollment penalty from Part D. So if you're not sure about it and you think maybe this is not a good deal for you, or you want to let this thing work out some just to see how it works for everyone and give it a year, you can opt out and then you can opt back in whenever you'd like in the future.
All right. So next question is, can one spouse opt into the Part D option and the other opt out?
Yes.
Cool. Awesome. And then, okay. So someone wants to know, so there will be an IRMA for Part D. So for people who pay IRMA for Medicare, will there be a separate IRMA for Part D if they opt in?
Okay, so if you pay IRMA and you're paying Part B IRMA, yes. If you get the PDP, you will also be subject to the Part D IRMA. And by the way, that's also true with Medicare Advantage plans. If you are subject to IRMA with Medicare Advantage plans, because the Medicare Advantage plan package Part D, you have to pay both Part B and Part D IRMA.
Okay, and if annual drug costs are low, does it make sense to opt out of Part D, excuse me. So this particular person says they have Blue Cross Blue Shield Basic.
Okay, so with Blue Cross Basic, you don't get the $2,000 out of catastrophic limit this upcoming year. You will get it in 2025. Next year, it's 3,250. So it's a little bit higher than the 2,000. So if you have low prescription drug costs, and you aren't subject to IRMA, then could you opt out? Yes. But understand that the prescription drug out-of-pocket costs, the copays for prescriptions, are going to be as good or better. I still have yet to see a case. And if someone has a case, actually, can you email me at guidetohealthplans@checkbook.org if you have found a case where you compared the price for the drug from an FEHB plan and you compared it in the PDP plan and you found that the cost in the PDP plan will be higher? I have yet to see an example of that. I'm not saying that example doesn't exist, but I would love to see that example if it's out there. So if you have one of those, please email us and let me know about it. But yeah, I mean, you could opt out. I mean, the only thing that I would say is you never know what's going to happen in a given year. And yes, there's some things that are known in terms of our healthcare expenses, but we don't know everything. We can't predict everything. And Blue Cross Basic, it's not as good as the $2,000 out-of-pocket max that you get with standard. But if you had a worst case year or a major hospitalization, having the PDP plan may be something that would help save you money. So you'll have to just manage that risk and decide which way you think is better for you.
Okay, awesome. And now we have a high deductible health plan question. So this one is about a specific scenario, but I think it would apply to a lot of people. So this person currently has a high deductible slash consumer driven health plan with United Healthcare, and United Healthcare currently pays money into an HRA. So they want to know if they keep their current coverage when they retire, will United still pay money into their HRA, or will they have to use what is left in that for premiums and other things until that money is gone?
No, you can use your HRA. So what happens? So a consumer-driven health plan works exactly the same before and after retirement. So there's going to be that monthly, or not that monthly. There's going to be an annual contribution into your HRA at the beginning of the year, and the plan tends to take out when you actually go to the point of service, you go to the doctor and they say, okay, that's going to be $50 or whatever. They're going to take that from the HRA, but you can also use the HRA for Part B premium reimbursement if you want. All of that operates the same way. However, in HRAs, there's sometimes a ceiling in terms of how high the HRA can grow. Often that's $10,000. And so if you have unused money, that's always going to roll over into the next plan year, but sometimes there's a ceiling there, but it's somewhat harder to hit that ceiling if the plan is always going to pull from the HRA when you actually use medical services. The high deductible health plan works different when you retire, when you're on Medicare, because before you were getting an HSA, a health savings account, and you were able to voluntarily contribute into the HSA. You were able to make investment choices and whatnot. And when you are retiring, you're on Medicare, and you have a high deductible health plan, instead of HSA contributions, you get an HRA from the high deductible health plan. You still get the same amount that the plan says that they're going to contribute to the HRA, but now the HRA is in place. You have the HRA in place, and the important thing with HRAs is that there's no portability. The plan owns the account. So what that means is if you were in that United plan, that United consumer-driven health plan that the person mentioned, and you decided, hey, I want to go to Blue Cross Basic, any unused funds in that HRA that are still present, you will forfeit when you switch health plans. So make sure you keep that in mind.
All right. And then we have a general Medicare question. So, how do you know if you are with a plan that doesn't coordinate well with Medicare?
Okay, so Section 9, really important to go to Section 9. They'll start about talking about coordinating with other insurance. Eventually, they'll get to Medicare. Oftentimes the plans will actually even give you charts where they will show you, hey, without Medicare, this is what you pay for a primary care doctor visit or a specialist visit. But then they will show you, if you have Medicare, this is what you'll pay. If you have Medicare Part B, this is what you'll pay when you go to a primary care or specialist. If that number stays the same, for example, if they say that you have to pay $30 to see a primary care doctor without Medicare and $30 with, and that plan also has a deductible, and that deductible still stays in place when you have Medicare Part B, you are in a plan that does not coordinate well with Medicare. And understand that there's two other options really that are out there for you. One, an FEHB plan that does coordinate well with Medicare. I'll give you three examples. Blue Cross Standard, Blue Cross Basic, they're going to zero out your doctor costs. In Blue Cross Standard, they're going to zero out the deductible. With Blue Cross Basic, they're also giving you Part B premium reimbursement. And then the other one that's very popular with retirees, Aetna Direct consumer-driven health plan. That plan is even better next year because they have the PDP coverage where you only have $2,000 out of pocket for prescription drugs. And with Aetna Direct, that's really the only cost that's left with Aetna Direct because they zero out the deductible and they zero out healthcare services as well. So check Section 9 of your plan brochure and then look at some of the national plan options that are available, such as Blue Cross Basic or Aetna Direct.
Okay, and it seems that we've gone a little bit over time, so I think this is going to be the last question that we have time for today. So, last one is about retiring soon. So, what would you recommend if you are going to retire soon? In this case, this person is retiring in July, and they need a plan that makes sense going into retirement. So, they're saying that they can't really take a Medicare Advantage plan, but could they switch within a plan to Medicare Advantage?
Yeah, I think this is it's kind of a bridge year, isn't it? Where this is like the last year where you don't have Medicare and you don't have to think about Medicare, but you're quite wise to start thinking about when I have Medicare, what's the best thing for me? And the first decision, of course, is whether to take Medicare Part B. And so you'll have to look at your income first and also understand that your income is a 2-year look back, and that your income for many people actually goes down when you retire. And so you may have to face IRMA right away, but you may not have to face IRMA down the road. You can also get in touch with SSA and let them know how your income is going to change in the future and try to appeal IRMA in that particular case. But whether you take Part B or not, largely determined about, your FEHB plan that you have right now, does it actually coordinate well with Medicare? And that's something that you can go look at right now. You go to Section 9, see, hey, if I'm thinking that I'm going to take Medicare Part B, what will these benefits be after I take Part B? And is this plan doing a good job of reducing my out-of-pocket costs? Next is, yes, you can't get into a Medicare Advantage plan now, but you could get into a Medicare Advantage plan next year. So what are those Medicare Advantage plans that are available to me? And we continue to expect even more Medicare Advantage plans down the road, more Part D PDP plans down the road. OPM wants annuitants to receive this better prescription drug coverage. And we expect more FEHB plans to start offering even more options next year. So let me thank Natasha and Abby for monitoring everything and moderating the Q&A and making sure this all happens correctly. Let me again just thank everyone for joining. Also, thank you for the support of supporting Consumers Checkbook, of purchasing the Guide to Health Plans. We probably didn't get to all of your questions. Again, if you send us a question at guidetohealthplans@checkbook.org, we'll do our best to answer them. That's a direct line to Natasha. It's a direct line to me. We'll do your best to try to answer this. Open season starts on Monday, so you still have a little bit of time, but you also have a major federal holiday here in a couple weeks. So again, want to thank everyone today. It's a big open season year. Part D plans are here. You're going to have to do some homework, even more homework than maybe you've had to do in the past, to see if those plan options are going to work out for you. So thank you again for showing up. Stay tuned. We're going to have more of these events, maybe not this open season, but in the future. And we're also going to start doing more in terms of education and outreach. You'll probably be receiving some emails from us in the future where we tell you about our advice that we're putting out on YouTube and some other things that we have planned. So stay in touch with us. We always want your feedback to know, how is the tool and the guide working for you? Are there things you wish we talked about that we didn't? Are there things you think we should cover that we haven't? We love your feedback. Keep it going. We hope today was useful for you. Thanks again.